So we want to get started with our second talk. This is on stress and parenting during the COVID-19 pandemic. Samantha Brown is our speaker. Samantha is an assistant professor in both the School of Social Work and the School of Public Health at Colorado State University. Her research is focused broadly on the risk and protective pathways by which early adversity shapes child health and development and family functioning. She applies a health equity lens to her work to test family-oriented interventions for marginalized low-income children and families living in high-risk environments. Again, very timely and relevant to the pandemic that we're dealing with. Samantha, please go ahead and share your screen, and we look forward to your presentation.
Thank you, Wendy. All right, can you see my screen right now?
We can, thank you.
Perfect, okay. Thank you everyone for attending our session on mental health and COVID-19. I'm going to expand on Dr. Epperson's wonderful presentation with a specific focus on stress and parenting and child outcomes during the COVID-19 pandemic. So I'll review some of the existing research that's been published regarding the impact of COVID-19 on children and families. And then I'm going to introduce some of the work that my colleagues and I have conducted in Colorado, and then conclude, hopefully also on a positive note, with some research and practice considerations that we might take from the existing work that's been done to meet the needs of children and families. So broadly speaking, families around the world have experienced a new range of stressors due to the global pandemic. And at the inception of the pandemic, we saw that many children were out of school or daycare without access to playgrounds, physical activities, and sports due to school closures. Parents were also required to work remotely or were unable to work while caring for their children without real certainty or clarity on how long the situation would last. Regarding economic hardship, it is substantially higher than it was before the pandemic, and we saw peak hardship around December of 2020. And then that did decrease after families received relief packages, but it's continued to rise. And it's estimated that about 42 million workers in the US have filed for unemployment. We also know, as Dr. Epperson alluded to it in her presentation, that COVID-19 has not impacted all families equally. So we see a disproportionate impact on families with low income and of color as well. For example, workers of color are disproportionately impacted by job loss, loss of income, as well as concentrated in essential jobs, placing them at increased risk of exposure to COVID-19. Regarding families specifically, 1 in 5 renters living with children are reporting that they're not caught up on rent. And families of color, compared to their white counterparts, are also reporting that they are not caught up on rent. Similarly, 14% of households with children compared to 17% of households without children report that they lack access to sufficient food to care for their families. And households of color are also more likely to report lack of sufficient food during the pandemic. So according to the minority stress model, minoritized individuals experience stress that is unique and chronic, arising from social and structural inequities that are additive to general stressors experienced by all people. So the accumulation of minority stress in turn drives some of these disparate outcomes that we're seeing among some families and children. We're also continuing to see trends that pandemic-related stress is associated with increases in family violence. Early reports of interpersonal violence suggest increases in incidents, hotline calls, as well as efforts to flee abusive situations worldwide. Regarding child maltreatment, self-report and spatiotemporal data in the US suggest specific risk factors implicated in maltreatment, as well as an increase in the prevalence of maltreatment compared to pre-pandemic times. And I will elaborate a little more about what we're seeing with regard to child maltreatment in Colorado in a few slides. So there may be unique factors that are influencing the outcome of children and families during this time, such as the risk of spillover and crossover effects. So by spillover, this means that it occurs when the exposure or experience of stress in one domain influences one's ability to function optimally in another domain. For example, stress experienced from economic hardship might spill over into parents' responsibilities in the caregiving role and their ability to be responsive to children's needs. In addition, children's experience of stress due to changes in their routine from COVID-19 might spill over in their interactions with their siblings or parents. And then crossover refers to how stress experienced by one family member leads to increased stress for another family member. So the impact of spillover and crossover might vary by mental health status, as well as the extent to which each family member is able to adapt, self-regulate, and cope with their current circumstances. So there are these multi-level determinants of mental health for children and families. We see evidence of higher rates of poor mental health compared to data before the pandemic. And in a meta-analysis of 29 studies, including over 80,000 children and adolescents, we can see that in this first figure, the bottom row, that the pooled prevalence rate of clinically significant depression among children and adolescents was 25%, and it ranged from 2 to 64%. For anxiety, the pooled prevalence was 21%, ranging from 2 to 50%. So notably, what we're seeing is that depression and anxiety has nearly doubled since the onset of the pandemic, and that rates are increasing as the pandemic progresses and among older adolescents and girls. Supportive parenting relationships are often critical for preventing the adverse consequences of stress on children's mental health and functioning. However, such relationships might be compromised, given that we're also seeing impairments in parental mental health during this time. And the image on this slide has been circulating around social media to make light of the current circumstances, but it likely represents the reality for many families. We see that about 2 out of 5 parents are meeting criteria for depression and anxiety. They're also reporting higher alcohol consumption, parental exhaustion, stress, as well as poor sleep, which subsequently impact their children's and mental health and functioning. So what does this look like for families in Colorado? Prior to the pandemic, I was working on a KO1 award where I was examining stress and sleep processes and self-regulatory processes in parents and children with low income and who were living in higher risk environments. So like many of us, soon had to pivot away from a more in-home intensive protocol to alternative methods. And so my colleagues and I administered a questionnaire to families that I was working with, as well as others in the Denver metro and Fort Collins area in late April and early May. And so what we knew early on about COVID-19 related stressors, we were interested in learning about participants' experiences, as well as their risk and protective factors that were associated with stress and parenting at the early onset of the pandemic. Parents in this particular study primarily reported that they identified as female and white, followed by Latinx, more than one race and ethnicity, and Black and African American. The sample was predominantly low income, with most families reporting that they were receiving statewide benefits such as food stamps, WIC, and Medicaid. And then more than the majority of the participants also reported they had a partner living in the home or were married. About half reported that they knew someone who tested positive for COVID-19, and about a third knew someone who died from COVID-19. And again, this was at the early onset of the pandemic. So we asked parents about their experiences of COVID-19 specific stressors. And they indicated whether they or their children experienced changes in 4 broad domains, which included relationships, work and education, physical health, and mood. And on average, parents reported about 3.5 of these main stressors. Regarding racial and ethnic differences, we found significant differences such that the mean score for COVID-19 related stressors for parents who identified as Latinx was significantly higher than those for Black and African American parents. And the mean score for COVID-19 related stressors for white parents was significantly higher than that of Black and African American parents. Regarding our primary outcomes of interest, our first model regressed parental perceived stress on demographic characteristics, as well as COVID-19 and mental health risk factors and protective factors. And so similar to what other colleagues have published, we found that COVID-19 related stressors and anxiety and depressive symptoms were significantly associated with higher scores of parental perceived stress. However, we were also interested in factors that might mitigate such risk. And so we asked parents about their perceptions of control during the COVID-19 pandemic, their level of acceptance, as well as how supportive their family environments were. And so over and above these risk characteristics, we found that parental support and perceived present control were significantly and negatively associated with parental perceived stress, suggesting that these factors might be important in protecting against higher levels of stress. Our second model included child maltreatment potential, which falls on the most extreme end of the continuum of parenting. And we found that receipt of financial assistance, depression, and anxiety symptoms were significantly associated with higher scores of child maltreatment potential. And similar to our first model, that parental support and perceived present control during the COVID-19 pandemic were significantly and negatively associated with maltreatment, suggesting again that they might be protective in or mitigate the risk of maltreatment. And so this data shows or tells us a piece of the puzzle, but we were also interested in learning about participants' experiences in their own words. And so we asked parents about how the COVID-19 pandemic has been impacting them, as well as their recommendations to isolate at home. And so several themes emerged from those inquiries that ranged from loss of employment, inability to care for their family, changes in mood and physical health, as well as lack of support. For example, one parent reported that our financial health has been very poor, with both of us out of work and not qualified for unemployment. Another parent said that to make sure my baby is taken care of during this time, I sometimes go without food. And several parents reported that depression has affected us in our household. So while these experiences kind of highlight the negative or stressful aspects of the pandemic, some parents also reported positives, such that by being required to stay at home, it actually provided more time for them to spend with their children. So if families are experiencing increased risk factors associated with parental stress and child maltreatment, why are national reports of child maltreatment decreasing since the pandemic's inception? For example, early on in April of 2020, media outlets noted that there were declines in referrals to child protective services across the US. So my colleagues and I sought to validate this claim with more rigorous data from administrative data in Colorado to see if this also was true in Colorado. And so this study examined child protective referrals, which include things like calls made to the Colorado's child abuse and neglect hotline, as well as responses to these referrals. So whether or not they were screened in to be investigated for allegations of maltreatment. And this slide might be a little difficult to see on your end, but this slide represents referrals by reporter type to Colorado's Child Protective Services. And so just to orient you briefly, the red dashed line represents the onset or the start of the lockdown in March of 2020. The black squiggly line represents the referrals made in 2020, and the light gray line represents referrals made in 2019. The x-axis is number of weeks, and the y-axis is the number of referrals made. So in brief, referrals decreased by 28% overall from 2019 to 2020 during a 17-week period following the start of the lockdown in Colorado. Specific drops in referrals were found by reporter type. So in the bottom row, there were substantial drops in referrals by school professionals. And then there were also drops by mental health and medical professionals, which is in the middle row because children were out of school and mental health and medical professionals were seeing less children in person. So not pictured here are the responses to these referrals in Colorado, which also suggests slight decreases in which of these referrals then were screened in for an investigation. And although the majority of referrals are from school professionals, only about 11% are substantiated as child maltreatment. And so this drop in referrals from school professionals might not necessarily represent a staggering number of missed cases, since less are accepted as a maltreatment substantiation compared to referrals made from law enforcement or medical professionals, for example. So in summary, families are experiencing many stressors associated with the COVID-19 pandemic. And with regard to child maltreatment, we're seeing that risk factors for maltreatment are increasing while reports to CPS are decreasing. So it is possible that children are hidden from some professionals who might be able to identify early warning signs of maltreatment risk. Again, I'm kind of being cautionary with these implications because I think we need to better understand the extent to which certain referrals are actually substantiations of maltreatment. So it's also possible that we are identifying the children who are at greatest risk. Due to COVID-19 stressors, children's mental health difficulties have doubled since pre-pandemic. Parents' mental health difficulties are also on the rise. Importantly, however, emerging research is documenting that certain protective factors might be key in mitigating the adverse consequences of COVID-19 on child and family outcomes. And so what can we do for children and families moving forward? I think there are several considerations from the existing work, but just to highlight a few. For research, we might consider including parents and children as partners in the research process, both to identify priorities and understand their lived experiences as the pandemic progresses, as well as during the pandemic recovery phases. We also need to implement longitudinal trajectory designs to confirm the long-term impact of COVID-19 on mental health and associated risk and protective factors. Much of the research that I discussed has been cross-sectional. There's also been a call from developmental scientists to collect parent and child data in real time to better understand dyadic processes, as well as these spillover and crossover effects that might be useful to inform effective intervention targets. Given some of my work with families living in higher risk environments, I had transitioned back to in-home data collection in the early summer because it better captured parents' lived experiences as well as increased the feasibility of collecting some biomarker and observational data. But there have been advancements in collecting similar data virtually, and so we may need to weigh the costs and benefits of those approaches as the pandemic continues. Given the disproportionate impact of COVID-19 on minoritized children and families, this work should also apply a health equity lens to better understand the structural and systemic inequities that might be driving some of the disparate outcomes we're seeing among children and families. And then I'll just note, just for time's sake, a couple of practice considerations. So I think one thing that's really important is that we can coordinate with key stakeholders to improve the accessibility of necessary services to meet children's and families' basic needs. And that will have a trickle-down effect on some of these other things that we're seeing. Also, efforts should focus on mental health recovery planning across 2 generations. So in settings that provide routine care, such as the pediatrician's office, providers can continue to ask about stress and mental health status among both parents and children and try to link them with key resources. I'll just kind of add that also some parents and families might benefit from structure during this time compared to their lives pre-pandemic, while some might also benefit from flexibility. But early research suggests that families with more structure reported lower depressive symptoms. And so we might work with families to implement consistent and predictable routine around sleep, schoolwork, physical activities, especially as the start of the school year occurs, where we might see some more unpredictability. And I'll just kind of conclude by skipping some of these, happy to talk a little more about them, but we can also learn from other countries that have kind of trends who are preceding the US in terms of challenges and opportunities that we might consider to improve the lives of children and families during COVID-19. So just to conclude with some acknowledgements of family participants, community partners, colleagues, funding support, and happy to open this up for questions in the time that we have, but my contact information is also listed here for any follow-up. Thank you.
Thank you, Melissa. Let me start by reminding everybody that you can post questions for either Dr. Epperson or Dr. Brown in the chat box. We have about not quite 10 minutes to address questions. But let me start off with a question for you, Samantha. I remember hearing early in the pandemic the concern that children were going to be sequestered at home in situations that are even more stressful than usual because of parents having to be there, losing jobs, et cetera, many reasons. And, the thought that they are then, if they're being maltreated, not having the same interactions with the professionals that would normally recognize that and report it is, this is really concerning. Do you think when we get back to a situation where there is more interaction of kids with their teachers and other professionals that we're going to see a huge spike in referrals to Child Protective Services?
It's possible. So in these are the trends that we're seeing are really also consistent with what we see during like holiday breaks, as well as when summer begins. And so we do generally see this tapering off of referrals by school professionals. And so now that children are starting school again, we'll likely see that increase. And I think what's most important though is that really trying to improve the training for professionals so that they're really identifying children who are at greatest risk. I think often we see that some children might be disproportionately represented or overrepresented in referrals to child maltreatment. And then when there is an investigation, it's not substantiated as a concern for maltreatment. And so I think that while we might see some of those trends, that the most important thing is to ensure that that their basic needs are being met. And a lot of these other factors that kind of confound what we think of risk factors for maltreatment. And so I think it's kind of weighing the kind of those things concurrently. But I don't think it's not really surprising that we saw a dip, since it does trend with what we see when summer starts and children are out of school anyways.
Right. And Neil, I had a question for you also. You briefly acknowledged the stigma that healthcare workers have about seeking mental health care. Is that a broad problem? Is it more prevalent in healthcare workers, or even if we had all the money available to provide all the type of mental health care we needed, would the people that really need it seek it?
Well, that's a great question. And yes, that's why I'm saying you can bring the horse to water. You can have plenty of water. You can even guide them and show them and try to do everything. You can't make them take advantage of it. It isn't just about healthcare workers. The paper that came out with Daryl Kirsch and colleagues was focusing, but very broadly, on healthcare workers. But, here on campus, we hear this from, people who are research leaders or administrative leaders, people typically who have this sense of themselves as, needing to set an example or needing to, be the strong one and, show the team that, you're going to be able to make it through this. And so we do get that a lot. But then also the whole issue about, promotion, my boss might find out about it, my department chair, and again, this is not just the clinical faculty on campus. We definitely hear this across research faculty as well. So yeah, I think it's, you don't get this far in your academic life without being pretty hard on yourself typically. Also, recognizing that you have to go, and that you have to be the strong one and represent that strength for everybody else. So that's where I get a little concerned about this concept of resilience. Like somehow I'm not demonstrating resilience, I'm not demonstrating strength. And I think that some of our leaders on campus here, and probably Colorado State as well, have actually been more open about their own mental health journey in a way to try and help people understand that they too, can seek mental health care, and that no, they wouldn't, they're not going to lose their job, or somebody's not going to think that they shouldn't go up for associate professor or whatever it might be. But it's very hard to get rid of fear. And a lot of it is fear. So stigma is often related to fear. It is very difficult to rewire the human brain and all the skills that we've used to get us to this point in our career, to all of a sudden let vulnerability be one of those skills that we bring to bear in our careers. It's very tough to get people to do that. But again, I think the messaging is getting out there.
Great, thank you. Well, I don't see any more questions in the chat box. I'm going to thank you for, I can't certainly describe this as an uplifting session, but certainly an awareness raising session. I learned a lot. I hope all of our participants have pieces of important information they can take away to either help with their own personal, mental and physical health, or their colleagues, their families. This was an important session to have. So thank you very much.